Good morning. Welcome. And my name is Izzy Greenberg with Childcare for CT. And this is our series on the economics of childcare. It's a three-part series, and I will be the moderator today. So we've gotten through our audio settings. I want to, of course, thank Sandra for being here and helping us to make these available to so many more people by interpreting for us. As a reminder, because I know a lot of folks jump in and out of these, we will be publishing the recording of this after the fact. So if you have to come in and out, don't worry, the whole thing will be available after the fact. Just as a reminder to everyone, we are using a sort of funkier version of Zoom called Zoom Sessions, which allows us to offer resources to you. So you should see a resources tab on your toolbar, and there you can access the bios of all of our speakers and the links to all of the presentations. About a week and a half ago, we had Catherine Ann Edwards, who is an economist, with us, and she did a full presentation, which is available. I'll share that link as well. And so her presentations here, we're going to be showing you a short clip of that. But all of the other presentations are also available there. So again, just want to welcome our legislators and advocates to the second webinar in our three-part series on the economics of childcare. So today we're going to be hearing from national and local experts highlighting the true cost of care and its economic impact. Our lineup today will be national experts from Prenatal to Five Strategies, reviewing the cost modeling for childcare, and then a presentation by social impact partners on the importance of infant toddler care, and then a wrap up with CBIA's CEO, Chris DiPentima. So let's get started. So here to kick us off, we've got Coalition Director Ava Bermuda Zimmerman. Ava, welcome.
Thank you, Izzy. Hello, legislators, advocates, coming off of the heels of our morning about childcare rallies across the state, where we had 1,500 parents and providers rallying for change, rallying for funding for childcare. It shouldn't be a surprise to hear that our economy definitely runs on childcare. Sadly, the childcare system in our state is broken. That is a reality. But we are fortunate enough that this year, the legislative body, as well as leadership, the governor, have been really trying to make an effort to change that. If we don't fix childcare, then children can't thrive and our economy doesn't do as well as it should. One fun fact here, or sad fact, one in every 7 early childcare teaching positions are unfilled in the state of Connecticut. And those teaching positions are not paid nearly as much as what they should be paid. And parents right now are paying way too much. Some areas, 20, 30, 40, sometimes 50% of their annual income just on childcare. So in order to get us on track here in Connecticut, get our economy on track and make sure that we're not losing gobs of money, make sure that we're paying teachers what they're worth, we want to have that conversation and map out not only why the cost of childcare is so high, but a pathway to fixing it in Connecticut. But don't hear my word from it. We have specialists and experts here. Let's listen to a clip from our last webinar series. It'll be a quick clip from Catherine Ann, Bloomberg economist, speaking on the economic impact of childcare. Catherine Ann?
So what's nice about thinking about childcare from this framework of the market has failed is that the consequences really give you a sense of what childcare investment from the public sector can generate for an economy. So I'm going to talk about the bad, and then also the kind of the inverse would be the good that was come from intervention. So right now in the childcare market, some parents pay for care. Some parents stay at home and provide care themselves, and other parents opt for informal care in quasi-paid or unpaid settings. And a lot of the evidence we have about informal care is that it's used in conjunction with other care. Like I put my kid in a child care, but I can't make it for pickup, and so someone picks them up after school, like a friend or family or a neighbor. So the first problem with this market failure is that if you pay for care, this greatly affects your family budget. right? If you're paying through the teeth for childcare, there's a lot of things that you're not spending that money on. So I give an example of there's a family paying $2,000 per month per kid. They'll spend $24,000 a year on childcare. So depending on how many years of care they seek, say 3 to 5, they could be spending $74,000 to $120,000 total on just the preschool care of one kid. You have two kids, you're kissing $250,000 spent on childcare right when the parents are in their prime earnings years, right? That commitment of spending to childcare takes dollars out of the economy for other spending, right? As well as limiting what kind of apartment or house you could rent, what kind of a house or condo you can buy, or your ability to save for retirement. It's a lot of money to put into one place that could have more beneficial effects on the economy overall. So this BOTE is econ speak for back of the envelope. So say there's 200,000 kids under 6 in Connecticut, and assume half of them are in a paid care situation, paying $2,000 a month. That's the equivalent of $2.4 billion that's not flowing to the rest of the Connecticut economy through food purchases, through travel, through shopping, through rent or housing. That money's going to childcare.
That was Catherine Ann. That was a quick clip, so a little flavor of what you guys missed last week, but you can catch the rest of the webinar series in our YouTube channel, Childcare for CT, on YouTube. Today, like Izzy mentioned, we have national experts talking about cost modeling, talking about the impact and the analysis that they did on infant toddler care and the cost of care here. But again, it's our job, just a reminder that session, it's funny for the legislators to hear this, but for advocates, session's going to end in 2 weeks, and it's our job to ensure that we have a proposal that does invest in childcare and creates a pathway to long-term sustainability. Information is power, so we're trying to use that information to spread the word as far as possible as to what the economic impact is on Connecticut and on parents. So I'll give it back to Izzy to take us away on our national experts who are on this call talking about their analysis. Izzy.
Thank you. And thanks for helping us to kind of have some framing for why we're here today. Okay, so now we're going to hear from our national experts, Simon Workman and Christin Davis from Prenatal to Five Fiscal Strategies on their cost of care analysis. So first, we're going to have a recorded clip of a presentation, and then in a little while, we've got a Q&A with them. So let's play that.
Hi, everyone. Welcome to today's presentation. My name is Simon Workman. I'm the principal and co-founder of Prenatal to Five Fiscal Strategies, and I'm joined by my colleague, Christin Davis. We're going to talk to you today about the true cost of childcare in Connecticut. So as I mentioned, we are with Prenatal to Five Fiscal Strategies. We're a national nonprofit organization that is focused on addressing really the broken fiscal and governance structure within the whole Prenatal to Five system, and very focused on childcare and home visiting and early intervention as 3 key components of that system. And our work happens across the country. We work with states and communities across the country to advance this idea of really centering children, families, providers, and the early childhood workforce in how we rethink this system to make it work better for everyone. And we've been very lucky to have worked with Connecticut over the last few years, and happy to be able to share with you today some of the most recent work that we have been doing with Childcare for Connecticut. So we're going to start with just a little bit of an introduction to what we mean by the true cost of childcare, and introducing the work that we're going to share with you today around the true cost of childcare at the provider level in Connecticut, as well as at the system-wide level, at the statewide level. So as I mentioned, we have been working in Connecticut for several years now. We helped the Office of Early Childhood to complete the narrow cost analysis, which is a requirement of the Federal Child Care Development Fund, which is part of the funding that supports your Care for Kids subsidy program. And as part of that funding, states have to complete either a market rate survey or what's called an alternative methodology using a cost model, and as well complete what's called a narrow cost analysis, so that states can really understand not just what providers are charging in the market, the prices they are charging families, but also what it actually is costing providers to operate care. So we developed a cost model to inform that narrow cost analysis in 2024. And then for this project, we are using that cost model with some adjustments that we'll talk about in a moment, to help understand the true cost of childcare in Connecticut aligned with the goals of the coalition. In addition, in order to understand what we call the big number model, what is the cost across the state, so not just at the individual provider level, but what would it cost to actually provide access to affordable childcare all across Connecticut, we created this big number model, which takes that cost per child numbers from the direct service model and adds some demographic data and some population data to estimate what does it cost to provide universal childcare in Connecticut. And we worked really closely with the Childcare for Connecticut's Future leadership to look at the assumptions that go into that model and then make modifications so that the numbers that we're going to share with you today are reflective of the coalition's goals. So I've used the term cost estimation modeling or cost modeling a few times now, and just to sort of clarify what that means, the cost estimation modeling is really about building a tool. In this case, it's an Excel-based spreadsheet that can estimate what it costs to provide care that meets the requirements, whatever those requirements may be, right? So there's subsidy requirements that are, in order to be a subsidy provider, you have to meet certain requirements. There's also requirements related just to being a licensed provider and operating a healthy and safe environment. And so the cost model takes a look at what are all the resources that are needed to actually provide that level of care, and adds them all up together and uses this tool to sort of say, this is the actual cost of all those things and meeting those requirements. And obviously personnel is a huge part of that, not just what are you paying educators and people in the building, but also what are you how many have you got, right? How many teachers do you have in the building? How many administrators do you have in the building? How many assistants, floaters, etc.? So one of the things that's really important in the cost estimation model is, not only the materials you need, the food, the occupancy, but also, how many people do you need in order to provide that high quality care, right? In order to do the things that are required of a provider at different levels, how many people do you need? So that's a lot of the work that goes into the modeling, is really understanding the time as well as the material resources that you have. And then what the cost model can do is it allows you to look at how does the cost of care change based on different choices you might make. So the cost of care is different for a program that is serving 30 children than a program that's serving 300 children, right? There's some economies of scale that come by that larger program. Similarly, the different ages of children served has a big impact. If you serve infants, toddlers, preschoolers, school age, that looks very different from if you only serve preschoolers or if you only serve infant toddlers. And the cost modeling can help you understand the fiscal impact of those programmatic choices that are often a choice by the individual program, but they're often also impacted by policies at the state level or the federal level, right? So if there is a policy that moves a lot of 4-year-olds into public school, we can see what the fiscal impact that has on childcare providers and what impact that might have on the cost of care for infants and toddlers. There's also lots of other things you can do with the model, understanding the geographic differences in the cost of care, understanding what it looks like if your program is full or if you have empty slots. You're still paying for the teachers even if you have an empty slot. If you're not collecting all of the expected revenue, the bad debt, to help programs at the program level understand the impact of certain business decisions they might make on actually their ability to be a financially sustainable program. The model can also be used to look at current revenue streams to understand what is the current funding that is available to cover that cost of care. So you have a cost of care, then you say, okay, what is parents able to pay? What is public subsidies, public funding able to pay? And is there a gap between the estimated cost and the estimated revenue? And how does that gap differ by population, geography, type of care, etc.? So overall, then the models can really be used to help understand both at the policymaker level, the impact of their policies, as well as at the individual provider level and at the advocacy level, really understanding not just the sort of simple answer of what is the true cost of care, but how that cost of care really differs by different characteristics. And so, as I said, we often are doing this modeling for policy development, understanding what subsidy rates should be or what other financial incentives might be. So if you pay a higher rate based on higher quality, is that rate actually enough to cover the cost of higher quality? Or if you're paying out quality incentives to encourage people to improve their quality of their program, again, are the incentives sufficient enough to cover the costs of the higher quality? Can also be used to help programs understand how to operate as a better business, right? And be as efficient as possible with the resources they have. So understanding the impact of, keeping on top of your wait list, making sure that you're as full as you can, as often as you can, and really thinking about how the cost data can inform, some of those business practices and understanding the fiscal impact of making certain changes to your program. And then on a statewide strategy, really looking and saying, what are our goals as a state for moving this field forward? And, what are the different costs, both the big costs, but also costs of, steps along the way to get there. And then on the advocacy side, the model's really helpful to educate people. So many times we get asked the question of, why does childcare cost so much, but teachers make so little? Like, where's the disconnect? Where's the money going? And the modeling can really help policymakers, but also parents and the general public understand the finances of a childcare program, the finances of ECE, and understand how personnel is a big primary cost driver, understand what happens when families are paying lower prices than our model will tell you the cost is, who is that actually impacting? And usually it's impacting the providers and the educators themselves, who therefore are getting paid low salaries because there's not enough money in the system, both from the public funding or from the private funding that families can afford to pay. And so then from an advocacy point of view, it can be used to understand what level of increased public investment might be needed, right? Understanding the inadequacy or adequacy of the current funding streams and how that differs, and really understanding the difference about who needs support to access childcare. In a world where we look at, the current price of childcare, looking at who needs help to cover that cost is very different than if you look at the true cost of childcare. And some of the numbers we're going to show you today, look at that true cost of childcare and say, okay, which families now need help covering that cost, right? It's a little different when when we're looking at the true cost of childcare than when we're just simply looking at the price of childcare. So now I'm going to pass it to Christin to talk about the results, the work of the direct service cost model, and some of the results that came out of the cost model.
Thanks, Simon. So as Simon mentioned, we're going to talk a little bit about some of the assumptions that we use for determining the direct service cost model. And we began by looking at the workforce compensation mid-year as our salary floor base. It was able to just give us a baseline to set salaries at. We know that personnel expenses are one of the largest share of a child care program's budget. And so the salary choices made are one of the most significant drivers of cost. We also looked at setting the capacities for all of the makeup of the programs. So the center capacity was set at 78. Group family child care homes were set at 12 with the inclusion of 4 school agers, and a small family child care was set for 9, including 2 school agers. We also looked at the makeup of staff. The center makeup includes a director, an assistant director or educational coordinator, and an administrative assistant. The family child care includes the provider themselves, and the group family child care includes 1 additional full-time assistant. We also looked at a few of the licensing levels. So the base includes all the assumptions of all running legally operated programs and meeting all training requirements. For centers and group family childcare, that is 6 hours of first aid and up to 21 hours of professional development. Small family childcare homes have 6 hours of first aid and 10 hours of professional development. This also includes health insurance and paid time off, which are built into those salary benefits. Some of the additional enhancements that we looked at was family engagement, 2 hours per child annually, which really equates to teacher and parent meetings that they are able to have discussions about the child's development. We also looked at planning and release time, so 1 hour per week for lead teachers and assistant teachers. And for family childcare homes, it would assume the provider or owner themselves would get that extra hour. Some inclusion supports are inclusive of 250 per child for IFSP or IEP, which is the Individualized Family Service Plan or Individualized Education Plan for materials yearly, and it also looks at the potential to have an aid. So this is really the base of the foundation that the direct service cost model was built on. Next, we're going to talk a little bit about some of the salary data that was included. So some of the salary data is used to determine the assumptions for understanding what the salary costs are. This cost model included 2 salary levels. The first one uses data from Connecticut's workforce registry, which reflects current salaries, and the second is the higher compensation option to better understand the true cost of care with higher compensation. For this data point, the model uses data from the workforce compensation schedule. It's based on the mid-year career placement. Because that compensation was completed in December of 2022, it is accounted for inflation so that we understand that those figures are increased for that change. For the cost model results in the scenario we are talking about today, the salary assumptions in the second column, which are highlighted in red, are used so the scenario represents the true cost of care with higher salaries. As you can see, under the scenario, the lead teacher salary is set at $72,753, with assistant teachers at $52,720. On our next slide, we're going to talk a little bit about the results and understanding the annual cost per child. These results, as you can see, that in a child care center, the cost of care is higher for younger children, which is due to the smaller ratio and group sizes in classrooms for younger children. The school age cost per child is the lowest, which reflects 2 things. First, that the ratio in group size is the highest of all the groups, because older children need less adults for supervision. Second, the school age rate reflects a schedule that includes full-time care during school holidays and a part-time schedule during the school year. In the group family child care and family child care home scenarios, the program operates essentially 1 classroom. There are not age-specific cost difference driven by the ratio requirements. However, programs are limited in the number of infants they can serve. So a program could not only serve infants, for example, without additional staffing. In our scenarios, the Family Child Care Home program is assumed to serve a mix of ages with only 2 infants in the small family child care home and 4 in the group family child care. We know that in the market, providers often charge a different rate based on age. But for the purposes of this cost modeling, the model produces the same rate for these age groups. For school agers, the rate is lower because just like in centers, the annual school age rate accounts for the part-time during the school year and full-time during the school breaks.
Great, thank you. So that was definitely a lot to take in. A lot of research and time went into that. And so we wanted to get a chance to ask some questions. So we've got Simon here to answer some of those. Ava, I'll pass it over to you to get that started.
Yes, just a quick reminder for folks who jumped on that we do have resources in the toolbar below you. It says resources. You click on it and you can have access to any of the content that we're sharing right now in live time. And we also have our YouTube channel will have the same slide deck and resources as well. Simon, what are other states up to? You gave us an introduction about the P5 team and how nuanced childcare funding is. But can you explain what type of analysis does a P5 team do, and like what other states have done, and how have they presented, to you and your team how they're going to tackle things after you've run the numbers and run the analysis?
Yeah, thanks, Eva. I mean, we at Prenatal to Five Fiscal Strategies, we're supporting states and communities really with providing data, right? That's a lot of what we do, and we firmly believe in the power of data-driven decision making. So, when we work with states, we're really thinking about how can we help you better understand the way the childcare system is financed, understand how it fits into your broader prenatal to five system, sometimes including your home visiting and early intervention services in addition to childcare, and then really understanding using the data to be able to explain to key decision makers and key constituents what makes up that cost of care so that you actually have the details when someone says, I really don't understand why it's so expensive. As Christin was just sort of breaking down the assumptions in the model, you can show, well, you have this many children in a room and you have this many teachers, and if you pay them this amount and you have this amount for occupancy, etc., that is the true cost. And often when you walk people to that with the data, they are more likely to trust your data, to understand your data, rather than just coming with a big number that someone can say, well, I don't understand how you're telling me childcare costs $30,000 a year when I have great childcare and I pay $20,000 a year, right? We can help them understand what's the difference between that 20,000 and 30,000, right? And mostly it comes down to what are you paying the educators? And, then using that data to really understand, if you want to pay educators a decent wage, you want to talk about an adequate wage, a living wage, when you use the model, this helps you really understand where those costs are. And so, I think that's also where, we talk to states about what their purpose of doing this modeling is, right? There is a continuum of cost modeling from, are you using it to set your subsidy rates? As we talked about in the video there, under the Childcare Development Fund, you can use a cost model to set or to inform your rates at the state level rather than the current market prices being used, right? Because the market prices reflect the problems with the current market. So there's using it for that, and we've worked closely with lots of states to really meet the federal requirements, build a model that meets those federal requirements, and then help them think about how you will implement that. Because often that number is going to be bigger than they can afford, but then that's where you start talking about your priorities. Is we can use this data to show what is the gap between the true cost of care and what you're currently paying. And often that gap is not the same for all ages or all program types, right? We know that infant toddler care costs a lot more than preschool care, as Christian was just showing. And what we see is the subsidy rates don't keep up with that. So the gap between what families can afford to pay, what public subsidies will pay, is larger for infants than it is for preschoolers. It's often larger in family childcare homes than centers. So that's where we work with states to say, if you only have this amount of money, where might you prioritize that amount of money, right? Where is the gaps the biggest? How do you make a system that's actually addressing the biggest gaps first? And that sort of talks to the other way we often use this modeling with people, which is looking at the sort of the big number and thinking about, okay, if that's the true cost of care, but if you want to, apply that to everybody in the state, if you want universal childcare, what does that cost? Or if you wanted to fund everybody who's currently eligible for subsidy at that cost of care, what would that cost? And we'll often be able to use the modeling to give different implementation steps, right, or different stages of that. We worked with New York a year or so ago with an advocacy group there, and we're able to do sort of similar modeling to we've just talked about today. But we're then able to say, if you wanted true universal childcare with these numbers, this is the number it's going to cost. Big number. Then here are like 3 other steps to get there. If you just served everybody currently eligible for subsidy, but at that cost of care, it's this amount. If you served up to 200% of poverty, up to 85% of SMI, all working families, so that really people have a roadmap. So you've got a number for the big goal, but you've also got a number related to those shorter term asks, right? So we really see the value in being honest about the cost of achieving your goals. But we know if you just sort of lay that out with nothing else, too often it's easy to turn away from that, right? Because it is hard. It requires a lot more money. So we like to use the modeling to really help understand, what are those cut points to get there, and having those be aligned with your goals and what the data is telling you about who is furthest behind right now.
Thank you. I appreciate that. And this is really complicated. So I'm curious, one of the things that we know is that this money doesn't come from nowhere, that the system is basically subsidized already. It isn't subsidized in ways that create the most success. It's subsidized by the low pay that workers get, by the healthcare costs that we all encumber because people don't have adequate health insurance. I'm curious how you think about that in terms of shifting the subsidy, because it seems like we're kind of already spending this money. And I don't know, I'm curious how you think about that.
Yeah, I mean, we're either spending the money or we are not spending the money and putting a burden on particular people, right? And we need to be honest about that. The number of times that people have asked me, why does childcare cost so much, but you're telling me teachers don't make anything, right? Or they say, you're telling me that childcare should cost this, but I have really great quality care for my child and I only pay half of that, right? My answer in both cases is to look at what's happening with the educators. If someone tells me they're getting great quality care, but they're not paying very much money, my answer to them is like, ask how much the educator is getting paid, because you will probably be very shocked to hear how low it is. And, that's where the burden is. Yes, you individually as a parent might not be paying higher tuition, but that means the educator is likely working a second job or is relying on public benefits, right? Or is going to school at the same time to try and like move on to a different job, right? There is a burden that is usually happening on the educators, which is bad in and of itself, right? These people that we ask to be the brain architects for children, to keep our children safe every day, are often dealing with their own stress about feeding their own family, providing for their own family, right? And that's because we don't pay them enough. But they also, are having, the public benefits. If they're on public benefits, there is a cost that exists there to the state or to the federal government. There's also the cost of high turnover, right? We see turnover of about 40% for early childhood educators, right? That is a huge burden for the people working in the program, right? It's bad for kids who like continuity of care, right? They like the caregiver that's sort of there and consistent. It's bad for the director of a program who has to spend half of their time recruiting staff, interviewing staff, getting new staff up to speed, rather than working on supporting their educators in the room, supporting the families, etc. So, there is really this hidden, impact. You're exactly right, Izzy. We do a lot of talking about childcare deserts, right? And that's a phrase that's become popular in the last sort of decade or so. And, when we talk about childcare deserts and talk about, there's this lack of access to childcare, it's not that children are just roaming the streets, right? They are somewhere, but they are in unregulated care, which doesn't necessarily meet the sort of health and safety standards we'd want, or they're being cared for by other family members, which is putting, grandparents into poverty, that is, putting grandparents who have, worked their whole life, who are now also exhausted and, probably haven't had good health insurance, whatever, like now in a place, right? So there is this sort of like, this system is, you can think it's working like above here because, oh, I have people coming to my work and, children are not roaming the streets, but underneath the surface, there are so many cogs that are moving and parents that are just doing what they can to make it work and cobbling together the bits of care that they can, right? And then that has stress on them and it means they can't get further ahead at work, etc., right? So there's lots of things that are happening to make this system look like it's working, but the reality is it's really not working for most people.
So, all right. So I think there is a sound here. My apologies if you can hear it. We've shared some of the legislative proposals that Connecticut currently has on the table. Capping the cost of care at 7% of parents' income is one. Some income limits on parents, creating a fund for health insurance. You've shared with us other innovative approaches other states have taken. Is there one approach that you like best? And I guess while you're talking about it, I'm curious, what is the percentage of GDP that states are spending when they have a high quality system? Like,
Yeah,
on average, is it, this state is this much, this state is that much, but really
yeah.
I'd like to see them get to this much because this is
Yeah.
really where you can have the best effect.
Yeah, I mean, to the first question on the, what are states doing? What are the sort of innovative things that are happening? Lots of states have been trying lots of things, right? I mean, I think there's been a sort of a movement, certainly in the last sort of few years. One of the things that COVID sort of did in the childcare system, it was so disruptive to the childcare system, but it also created some opportunities, and some of the federal funding that came in to try and help shore up childcare allowed some states to take some chances with that money and think about different things, right? So Massachusetts created some foundational grants, kind of instead of looking at the per child funding. Per child funding creates a lot of flexibility for families, right? Here's a voucher, basically go pick any childcare program you like. But it doesn't provide any stability for childcare centers or childcare programs who, a kid could be there 1 month or not the next month, but they're still paying educators every month, right? So Massachusetts' approach was to use these foundational grants that basically gave, a percent of the cost of care as a foundational grant to programs every month so that you sort of had this stable base, right? And then you're building on per child things on top of that, but you had a stable base. And that was really to try and address this idea that you needed some stability in the system for programs to, open new classrooms, to really make some investments. You've got states that are looking at, there's a thing called the tri-share model, which began in Michigan and has been piloted in a few other states, that sort of looks at basically dividing the cost of care equally between families, public funding, and businesses, really reflecting, who has a benefit from childcare, right? Families pay a third of the cost, the state pays a third of the cost, and then a business commits to paying the final third of the cost in a way that helps reduce the burden on families, gets more money into programs, and asks businesses to sort of contribute in a way that does reflect the benefit that they get by parents having access to childcare. I think one of the things that's been interesting as we've looked at sort of different proposals from different states is this question of, and you mentioned Connecticut talking about 7% of your income being the limit. And that is the sort of federal recommendation about, what we sort of define as affordable childcare is 7%. I think Catherine Ann Edwards in her presentation sort of remarked on just how much families are currently paying for childcare, right? It's sometimes upwards of 20% of your income, and can, come up to you huge amounts of money over the course of, it costs more than college. And, no one's got a 529 for childcare, like then 20 years to save for it, like they might do for college. And so, that question of what the burden should be on families, and, we saw some states really reduce that copay and say, we're going to ask families to pay, almost nothing. The problem with that is unless you also put more money into the system, the provider then has to make up that difference, and they make it up usually by not being able to pay educators anymore, right? So I think that's where we really look to the encouraging places where you're honest about what the true cost is. You're honest about what that means for who can afford to pay. In the example of, if childcare costs $15,000 a year, the question of who needs assistance to cover that cost is very different from if we're honest, the childcare costs $30,000 a year, right? And so a lot of the systems we have and the eligibility we have is based on that $15,000 number. If you actually look at, $30,000, then eligibility needs to be very different. And it's something we saw New Mexico do. They expanded eligibility to, 400% of federal poverty, which now covers, 85% of families with young children in New Mexico. So really reflecting that most families need some support, right? And at different levels, you're not necessarily covering the full cost of care for everyone, but you're looking at different levels. And again, back to my, beginning comments about data, you can really use the data to understand, who needs the help the most and where that support comes in.
So final question then for you. I'm curious, the impact on some like a New Mexico. I know I saw something that poverty had decreased, or we do see benefits in other states depending on what they're doing, and the benefits have been different. And I'm curious, we've got about 1 minute left. What the impact on the workforce, the impact on the economy when you do this maybe in a more expansive way? What could you expect to see, and where have you seen success?
Yeah, I mean, it's hard to fully pull out exactly where the changes have been specific to this, right? Often they've happened as part of a broader thing. In New Mexico, they put a lot more money into the system. And we've seen a huge uptake in access to services, right? They are now at, 50% of 3-year-olds having access to care, about 80% of 4-year-olds. They've significantly improved infant toddler care. In Virginia, we know that, the number of families accessing subsidy has significantly increased because providers saw more value in being in the subsidy system, because now the subsidy rate is actually covering, close to 100% of the cost of care, as opposed to before where you'd say it's not worth me investing in the subsidy system. And so, you start to see those changes where childcare deserts decrease, turnover decreases. The hard data on what the impact is has been hard to capture yet, partly because of COVID and, where do you isolate things? I will say in the preschool realm, in DC, they've been now investing in universal preschool for about a decade or more. And some analysis that was done a couple of years ago found that there was a 10 percentage point increase in maternal labor force participation due to that increase in preschool access, right? By having access to preschool, more mothers were able to go back to work if they chose, which has then obviously an economic impact both for those families on having more money in their family income, in their family budget, but also for the economy where those people are paying taxes, right? They are now, and the workforce is paying taxes. So, it's really one of the smartest investments you can make. And that's why, the OECD average says you should invest about 0.8% of GDP in your childcare system. The US currently invests about 0.4%. So, we have a long way to go. States like New Mexico are getting close to there. They're at just over 0.8% now for their whole prenatal to 5 system. But so when we think about what should we be investing in this system, it really is double what we are currently investing. And that's really what's necessary to get all those gains for businesses, for families, and for children.
That's amazing. Thank you. Simon and Christin, thank you both so much for that. We are really appreciative of the time and the work that you've put into this, helping us understand this. It's really complicated, but we look forward to digging in even more with you in the future. So very much appreciated. Okay, so we've got some more, guys. We are next going to pass it over to Skye Cornell, who is with Social Impact Partners, one of our partners, to review the impact that on infants and toddlers. So Skye. Welcome.
Thank you, Izzy. And you'll be putting up the slides, right?
Yes. Yep.
Okay, great. So, good morning. I'm Skye Cornell. I'm the Director of Nonprofit Consulting at Social Impact Partners. And I know that there's going to be more information in the resources about our organization. So I'll just briefly say that we're a Connecticut-based nonprofit, and we're really driven by this a vision for expanding economic mobility for families across Connecticut, which is why we are very focused on early childhood education and care, along with other key initiatives that are really helping families to build for the future. So I'm glad to be here today to talk about one of the areas of the greatest need in early childhood education, and that is infant and toddler care. Over the last few years, this has been a big part of the discussion in our state, including through efforts like the Blue Ribbon Panel on Childcare and the 5-year plan that came out of that. It's very clear just how significant the gap is in infant and toddler care. And these are, of course, our youngest children, younger than age 3 in the state. Just to start off, because we've heard a lot of data and information today, I like to think in terms of what does this need look like? What does this look like for families? And so when you think about it as a family, and I think we've all seen this here in Connecticut, first of all, many parents just simply can't find infant and toddler care. Even when they start looking, from the moment that they know that they will be having a baby, it's very hard to find. There are a lot of wait lists here in Connecticut. And with what you heard from Simon, we know why, right? The business economics just don't work for childcare providers, and so there isn't as much offered. And then even when families do find a spot, it is often unaffordable. We've heard, you see the cost of it, but when you really hear families talk about it in the terms of their day-to-day life, it's more expensive than a mortgage. It really, you can see why it can lead some parents to, or a parent in a working family, to have to leave the workforce altogether. We will hear, more shortly from CBIA about the workforce implications, but we know that this creates a real cycle in working families, and it puts them behind in their their lifetime earning potential. We know it holds back our economy too. So to put some numbers behind all of this, if you look at the slide, you can start to see, Connecticut has 181,000 children under age 5. Of these, about 94,000 children are under age 3. These are infants and toddlers. And this data comes from the Census Bureau. It's the American Communities Survey. And in the next slide, we'll talk a little bit about the genesis of this conversation. When we spoke with Child Care for Connecticut a few months ago now, there's awareness, right, of the universal preschool plans and proposal. And Child Care for Connecticut asked us to look at what's the demand for infant and toddler care in the context of this broader universal preschool strategy that's under discussion. And the reason for discussing it in an integrated way, it's important because Connecticut, as Simon talked about these pathways, building pathways, Connecticut has been on this pathway toward streamlining, toward making things easier for parents, for childcare businesses. So the idea in looking at the demand was always about exploring opportunities to have something that fits together with universal preschool, because that's also so important in our state. And on the next slide, you can see some of the details about what we were able to look at. So using a 50% demand rate, which is what aligns with Blue Ribbon Panel's assumptions, we found that about 47,000 infants and toddlers need care. There's that demand for care here in Connecticut. Of that, when you break it down further, you look at household income, and 23,000 children are in households that are earning less than $100,000. Another 93,000 are in households with an earnings of 100,000 to 150,000, and about 14,500 are in those homes with incomes higher than that 150,000. So that was a first and initial look. And but keep that number in mind, that overall need is the 47,000. And from that, these conversations and with Child Care for Connecticut and looking at the demand, really three key themes emerged. One is that current subsidies matter, and there's really a starting point here. So current programs are really a critical foundation, and these are the programs like Care for Kids. It's not enough right now in our system here in Connecticut, but it is a key step on the pathway that Simon was discussing, and these should be maintained and improved along with any additions to the system. The second theme that was discussed related to infants and toddlers is really about how much the need far outpaces what is available. So even with subsidies that we know we have some subsidies currently, as we said, in our system, families still face an affordability crisis. Simon just spoke about this in greater detail. But there has been other work to show the size of it here in Connecticut, and recent data from a report from the Connecticut Data Collaborative and the Connecticut Project, for example, show that the vast majority of families, 87% of families, actually would have to pay more than the federal affordability benchmark for full-time center-based infant and toddler care in Connecticut. And when we're talking about infants and toddlers, the care really does happen in centers and in family-based child care providers. So just thinking about that, when you're talking about 47,000 children, 87% of families with facing potential affordability challenges, you can really see that this isn't a niche issue. It's really widespread. And if you look at that report, and what we know is that it is really across Connecticut. And finally, the last thing as I wrap up, we spoke about lessons from other areas, particularly where they have expanded for universal pre-K. And one to look out or one to bring here is from New York City. And New York City in the last decade, as many know, has really significantly expanded their universal pre-K. And one of the lessons that they learned is that if you only focus on preschool and pay those more sustainable rates for preschool, it can inadvertently cause a destabilization in infant and toddler care. In New York City, what this study found is that there was a reduced capacity of 2,700 seats for children younger than 2 years old. And the reality was that entire decrease in capacity occurred in areas with rates of high poverty, and the decline wasn't offset in other areas. So it's an important lesson to look at for Connecticut, a reminder about the importance of looking at the whole ecosystem, thoughtful integration, and in expanding access in a way that truly supports families, builds that strong workforce, and makes the smartest use of public dollars. So with that in mind, I'll wrap this up and just say thank you for the time and for to Child Care for Connecticut for bringing this to the fore about the need, more and more about the need for infant toddler care. I really hope that these numbers and this information has helped to paint a picture of the scale of the need and some of the context that we are working within here in Connecticut. And with that, I will turn it back over to you, Izzy.
Thanks so much, Skye. We really appreciate you helping to break this down and to kind of bring us that local level. I think we can stop this screen share. Perfect. So thank you so much for bringing it kind of to we were zoomed out and now we're kind of zoomed in. And I'm going to, so thank you. I'm going to now introduce Christy Pentima, who is the CEO of the Connecticut Business Industry Association, because it's also important to understand that childcare does not affect just the children in care. It does not affect just the parents who are struggling to find care, but it affects our workforce, it affects our businesses, our economy. And so, Chris, welcome you, and I'll turn it over to you now.
Yeah, I'll be quick. I know you guys are up against the clock here, but thanks for letting me join you. Izzy, thank you, and Eva, obviously, for all your advocacy this session too. I don't know if all the folks on the call realize the partnership with CBIA and Childcare for Connecticut and how we've been working behind the scenes on hopefully getting some good policies through this year and beyond. So just, quickly, what's it mean for the business community? Really, what's it mean for Connecticut's economy, and why is CBIA engaged in childcare advocacy? And one of our top priorities this year is expanding affordable, accessible, quality childcare. We've been at it for a couple of years now. The last budget cycle, we were able to get some tax credits through for businesses who either help subsidize employers' childcare costs and or are investing in a childcare facility. I heard Simon mention TriShare, and last session we were able to get a pilot TriShare through, which is going very, very slowly right now. And so we've got to keep at this with other priorities. But the reason why we're involved is two reasons. We've had a workforce crisis in Connecticut since pre-pandemic, and we continue to have one. We have 72,000 job openings right now and about 70,000 people looking for work, so almost a 1-to-1 ratio. And there's two ways to fill those jobs. One is getting more people who live in Connecticut into the workforce, or what we call increasing labor participation. And the other one is attracting people to the state to grow our workforce. And the child care solution hits both of them. When you look at labor participation rate, men to women is pretty much equal at about 90% up to age 30. And then after age 30, there is this incredibly massive drop off where the participation rate for men, labor participation rate is 90%, but for females, it drops off to 70%. And we know, females often bear the brunt of domestic support, childcare, access to childcare, the affordability of childcare is a big piece in that. And when we do our research and analysis, it looks in our mind that there's about somewhere between 30 to 50,000 women who are maybe on the sidelines who could be in the workforce, but for this childcare hurdle. And the second point I mentioned is attracting more people to the state. And when we often talk to people who are recently moved to the state or reluctant to move to Connecticut, it's cost driven. And the four major things they cite are the cost of childcare, the cost of housing, the cost of energy, and the cost of health insurance. And so that's why in this year in our priority solutions, our Reimagine Connecticut solutions, childcare is one of the top 10 priorities for us at CBIA and for the business community because of those two levers that it actually hits to help grow the workforce and fill these job openings that we have in the state. So again, I just wrap up. Thank you guys for working with us. I think it's an incredible partnership and that one that just won't end this session, but we'll continue to work on in the sessions to come as well.
Yeah. Thank you so much, Chris. And thanks for making time. I know you're moving between things and so grateful for the partnership and the time you're able to make for us today. So that's it, folks. So we're going to wrap it up. I just want to thank Chris, thank Skye, thank the Prenatal to 5 team, Simon and Christin. Childcare for Connecticut is really proud to partner with these groups. These are smart people doing deep thinking and really thinking holistically about how we can get to a solution to not just our childcare crisis, but something that will support our entire state and our entire economy. So it's a big deal. I would love to just take one moment to thank any lawmakers who were able to make time this morning. I know this is a very hectic time of session for you all to be here, but we're so grateful that you are making this a priority. We will also be sharing this out as promised with lawmakers after the fact because so many just can't find time to set an hour aside at this time of the session. So as promised, we will be posting this to our YouTube. We will also be sharing it out by email and in other ways after the fact. So stay tuned. If you guys want now, you can go to the resources tab to download any of the materials shared today in both English and in Spanish. We will also post those after the fact with on YouTube with the recording. So we're going to continue this work. If you all want to join it, you can go to childcare4ct.org. You can follow us on social media at childcare4ct. And stay tuned because we've got one more installment in this series to come in the next few weeks. Thanks everyone for being here. Have a wonderful day.